So in terms of lymphoma, I think some of the long-term follow-up data comes to mind. For example, the one that Dr. Abramson presented on the STARGLO study, which was in patients with relapsed refractory DLBCL, ineligible for a transplant, randomized to R-GemOx versus GemOx plus glofitamab. And this was a 2-year data set, which showed that on the glofitamab GemOx arm, which is the arm that showed a significantly superior PFS as well as overall survival. Important to underscore that the overall survival benefit maintains. More than 50% of patients continue to be alive. And in patients who achieved a complete response, the overall survival was excellent, obviously, but also the PFS was not reached. So another way to potentially take care of our patients who may not be able to get to CAR, either because of logistical barriers or socioeconomic barriers, or just because the disease is proliferative. So I think STARGLO gives us a peek into that. The other study, I think, that looks at long-term data set is the one that was presented by Dr. Tam, the SEQUOIA, the arm C, where zanubrutinib was explored and investigated in patients with deletion 17p or TP53 aberration CLL. And really heartening to see that at the 5-year mark, both the PFS as well as the overall survival is, looking very good. 5-year PFS is over 70%. No new safety signals were seen. And interestingly, they also have published zanubrutinib outcomes in patients without deletion 17p. And it's very intriguing to see that there were no differences between deletion 17 and non-deletion 17p enriched CLL patients. That really goes on to show that zanubrutinib can abrogate the adverse events of deletion 17. In terms of other data sets that caught my attention, I think it was a SYMPATICO study that was presented by Dr. Michael Wong in untreated patients with mantle cell lymphoma, either older or with TP53 mutation. And so far, it looks very durable in the non-TP53 mutated population and the younger population with TP53 mutation. SYMPATICO explored ibrutinib plus venetoclax for 2 years, followed by ibrutinib indefinitely. More than half of the patients did discontinue one or the other drug, but I think it was a very fabulous strategy to figure out and explore chemo-free options for patients who are high-risk mantle cell lymphoma. So I'm looking forward to getting some more updates on that study as the study continues to mature.